for many urologists. That's because men across the country will schedule vasectomies. A lot of men book the procedure around the time of the NCAA basketball tournament so they can watch during their recovery. So what does the vasectomy entail? Here now to discuss it is Dr. Kathryn Wagner, urologist with Hartford Healthcare's Tallwood Urology and Kidney Institute at Mid-State Medical Center. Doctor, thanks for being with us.
Thank you for having me.
All right, so there are men out there who've possibly been considering this. How does the procedure work?
So, great question. We typically do a vasectomy in the office under local anesthesia. It's one of the safest and most effective forms of contraception that we have. And if I can take you back to health class, the vas deferens is that long tube that carries sperm from the testicle all the way to the base of the prostate. During the procedure, we just take out a small segment of each vas, and that results in sterility for the man.
Okay, generally, how long is the recovery and what does it entail?
Usually men will experience a couple days of swelling and bruising in the area. Usually ice packs and Tylenol are enough to manage. We typically recommend avoidance of sexual activity for about a week after the procedure and no strenuous activity or heavy lifting for about 2 weeks. Now, one of the most important things to note is men aren't sterile. They could still potentially get their partner pregnant for up to 3 months after the procedure because sperm can live in the vas for over 70 days.
All right, a common question, can a vasectomy be reversed?
Technically, vasectomy is reversible in some cases, but it does require a surgery. That surgery can be pretty expensive, and we can't guarantee that it'll work. So because of that, we typically do consider vasectomy to be a permanent procedure. If men aren't convinced that they're done having children, we recommend another form of contraception.
Doctor, what's the most common question you get from men about this procedure?
Well, there are a lot of misconceptions and myths out there about vasectomy. One of the most common is that it somehow changes sexual function, which thankfully it does not. There are a lot of great resources for information online, but scheduling an appointment with a urologist is another great place to start for more information. And within Hartford Healthcare, we have several Saturday vasectomy clinics during the month of March to help men get access to this procedure.
All right, and if men are thinking about doing this, what advice would you have for them and how can they start? Maybe attend that session?
Absolutely, and certainly discuss it with your partner. Make sure you're on the same page about family planning.
All right, Dr. Kathryn Wagner, thank you so much for joining us. We really appreciate all this information. And you are with Tallwood Urology and Kidney Clinic at Mid-State Medical Center, part of Hartford Healthcare. Thank you.